Hello and welcome. Today we're diving into a fascinating, albeit less commonly discussed, condition: cochlear otosclerosis. While otosclerosis is known for affecting hearing through bone changes in the middle ear, cochlear otosclerosis primarily impacts the inner ear, leading to a different set of challenges. Join us as we explore the causes, symptoms, diagnosis, and management of this complex condition. The exact cause of cochlear otosclerosis, like traditional otosclerosis, remains somewhat elusive, but genetics are believed to play a significant role. Research suggests that certain genes increase susceptibility to developing the condition. Environmental factors, such as viral infections, have also been hypothesized as potential contributors, but more research is needed to confirm these links. It's important to understand that cochlear otosclerosis is not typically caused by external injuries or loud noises. The pathophysiology of cochlear otosclerosis centers on abnormal bone remodeling, specifically in the otic capsule, the bony structure surrounding the inner ear. This abnormal remodeling disrupts the delicate structures within the cochlea, the hearing organ responsible for converting sound vibrations into electrical signals that the brain interprets. The cochlear fluids and hair cells, essential for auditory function, are affected, leading to progressive hearing loss and sometimes balance disturbances. Epidemiological studies on cochlear otosclerosis are limited because it's often difficult to distinguish from other forms of sensorineural hearing loss. It's believed to be less common than traditional stapedial otosclerosis, which affects the stapes bone in the middle ear. While precise prevalence rates are unknown, it is thought to affect a small percentage of the population and can occur alone or in combination with other hearing problems. The signs and symptoms of cochlear otosclerosis primarily involve sensorineural hearing loss, meaning the hearing loss originates in the inner ear or auditory nerve. This hearing loss is typically progressive, worsening gradually over time. Individuals may also experience tinnitus, described as ringing, buzzing, or hissing sounds in the ears. Dizziness or balance problems can sometimes occur, but this is less common than in other inner ear disorders. It's important to note that the symptoms can vary from person to person. Diagnosing cochlear otosclerosis can be challenging. A comprehensive audiological evaluation is crucial, including pure tone audiometry to measure hearing thresholds at different frequencies, and speech audiometry to assess the ability to understand speech. Tympanometry measures the function of the middle ear and can help rule out other causes of hearing loss. Computed tomography as CT scans may be used to visualize the otic capsule and identify signs of abnormal bone remodeling, but may not always be definitive. A definitive diagnosis often relies on a combination of clinical findings and imaging results to exclude other causes of sensorineural hearing loss. While there aren't distinct subtypes of cochlear otosclerosis in the same way that otosclerosis has stapedial and fenestral classifications, the severity and progression of the condition can vary. Some individuals experience a slow, gradual decline in hearing, while others may have periods of stability followed by rapid worsening. The specific frequencies affected by hearing loss can also differ, impacting the perception of different sounds. Currently, there is no cure for cochlear otosclerosis. Treatment and management primarily focus on alleviating symptoms and improving quality of life. Hearing aids are often the first line of intervention to amplify sound and compensate for hearing loss. Sodium fluoride has been explored as a potential treatment to slow the progression of bone remodeling, but its effectiveness remains controversial. In severe cases, a cochlear implant may be considered. A cochlear implant bypasses the damaged cochlea and directly stimulates the auditory nerve, restoring some degree of hearing. Unfortunately, there is no known way to definitively prevent cochlear otosclerosis, given the suspected genetic component. Genetic counseling may be beneficial for individuals with a family history of otosclerosis or unexplained hearing loss. Maintaining good overall health and avoiding excessive noise exposure can potentially help mitigate the risk of developing or worsening hearing loss. But these are general recommendations rather than specific preventive measures for cochlear otosclerosis. The prognosis for cochlear otosclerosis varies. In many cases, the hearing loss progresses slowly over time. The effectiveness of hearing aids or cochlear implants in restoring hearing can differ from person to person. Recent research is focusing on identifying the specific genes involved in otosclerosis and developing targeted therapies to inhibit abnormal bone remodeling. Additionally, investigations into the potential of regenerative medicine to repair damaged cochlear cells are ongoing. While a cure remains elusive, ongoing research offers hope for improved treatments in the future.